All right. I'll just give a brief introduction on what we're trying to do here. In a nutshell, I've already shared this with you, but in a nutshell, we're trying to learn about how posture impacts the well-being of individuals, especially focusing on people doing desk jobs.
Got it. Got it.
Yeah, and just a little bit of background from what we have learned in the last, conversations and discussions that we've been having over the years. There's been like the IT boom, the tech boom, and the rise of so-called desk jobs. And with mobile phones and laptops being so accessible, the way we function day to day has drastically changed, right?
Right.
So our lives have drastically changed, whether it's work or recreation. I can just sit in one spot and access the whole world. So with that, what are the repercussions that we're having? So that's sort of what we are focusing in on. Personally, we've had a tough journey. The last 2 years have been really challenging. Even now, this is like my life support at this point. This is sort of how I function with a brace every day. And that's become how I've got to navigate this. But a lot of my peers in this age group have also started developing different kind of ailments like carpal tunnel, lower back pain, cervical issues. I think I'm too young for that, but that's also starting to happen quite a lot in this age group. And also
Mhm.
migraines have come up. So and this is just like getting started for us, right? So these are very, very dire consequences. And every time I've consulted a doctor, no matter which field it is, the first question I've been asked is, what is your profession? So,
Hmm.
is it IT? Is it tech? Are you an architect, design? So the moment I say what my profession is, it's like, oh, occupational hazard. So that's sort of the feedback that I've been getting, and then
Mhm.
instant reactions that I've been getting, and which makes us believe that this is getting very common these days. And as a result, there's like the strain and stress caused by bad posture. So sort of what we want to lean in towards. There's a lot of conversation around fitness. There's a lot of conversation about diet, etc. But we have not really seen a lot of active communication around posture. And the last few years have been in a lockdown. The work culture has changed drastically. So again, keeping in mind all of this is sort of what we want to sort of understand and explore a little further. Yeah.
Yes. So, first of all, it's very good that you guys are taking up an initiative to dig deeper into this, because since it is such a common issue, right? Doctors only play a part that applies to any health condition for that matter.
Mhm.
Doctors are only a part of your treatment, right? Taking initiative and taking enthusiasm in our own health decisions and trying to understand uh, deeper aspects of it, right? I think that is very important. And as such, this initiative that you guys are taking up uh, is very nice for that matter, right? So, saying that, yes, so recently a lot of back issues, a lot of chronic back pain. So, back pain itself has become very chronic issue to deal with for many patients these days. And part of it is definitely because of being accustomed to a desk job or some other professions that can lead to back pain are something which involves lifting heavy objects, even fitness professions, right? Physical therapists and yoga therapists, if their approach to their work is not optimized, they can definitely end up with chronic back pain.
Right.
And yes, go ahead.
Right. So we just wanted to, we had a few questions in a structure and I would share that with you. It would be interesting to go in that direction. So
Sure.
I'll just start with an intro about you and what you do.
Sure. So I'm a general practitioner. I'm a licensed medical doctor in Bangalore, but I'm a general practitioner. So which means I've completed my MBBS, and I've been working since 2019 now. So through the pandemic and currently I took up some exams in order to pursue my specialization in USA. So I'll be moving there maybe in 2025. So currently I'm taking up, consultations from all age groups and all different type of health issues which are uh, possible to handle online. So that's my background. Uh, yes.
Yeah, if you don't mind, what are you pursuing specialization in? Do you have any?
So I'm going to start my specialization in internal medicine. It is just further. So general practitioners handle patients on an outpatient basis mainly. Common concerns which are not life-threatening, common concerns that might not require a hospital admission or an ICU admission. But when I go into internal medicine, I'll be more specialized to handle patients who are inside the hospital, say admitted or in the emergency room, in the ICU.
Okay, thank you. Um, how does posture or posture related ailments relate to your field?
Yeah. So while posture related issues, mainly back pain, right? It has become extremely common these days, as common as common cold. Not to downplay its seriousness, but you know highlighting the fact that it has become extremely common. So fortunately, 90% of the cases of back pain are not something which are debilitating or which might cause long-term disability in patients. Uh, and I will be the first contact usually for many of the patients who experience back pain for a long time and they feel like this warrants a medical consultation. Now it has been going for a long time now. So since 90% of them are something which are based on non-serious or non-debilitating causes which would not cause long-term disability, I would say general practitioners are the one who will primarily handle back pain patients, and and also decide if referral is needed to an orthopedician or a spine surgeon or for physical therapy as such. So the initial treatment and the initial approach to back pain starts with the general practitioner, and then if the problem is something, if there are some red flag symptoms, as we call them, we definitely refer them to a hospital or to an orthopedician for specialized care.
Um, would you be
Does
able
that
to?
answer the question? Yeah.
Yes. Okay. So what is like the most common posture related? You mentioned back pain. Is there anything further you want to elaborate on? Are there other kind of ailments that are directly related to this? And to extend that question, what kind of age groups or gender do you see that leaning towards? And which body parts are basically more commonly affected? Like I said, like, any others? I mean, knee pain, joint pain. You can elaborate a little bit.
Yeah. So I just, took up a slide here. I'll just present my screen for a moment if that is okay,
Yes.
so that the approach will become a little more clearer. Uh, Is my screen visible?
Yeah.
So this is a medical school lecture that I just, I chose a particular slide from it just to, delineate the different causes that might lead to back pain, right? We will definitely get into the causes of other joint issues shortly. But as you can see, right, there are various different causes which we can split up into three categories. So primary back pathology is something, which is directly originating in the back. Uh, Anything that is not to do with some other issue in the body, but it is happening directly in the body, directly in the back, right? So among that, you can see that musculoligamentous injury or lumbosacral strain, right? It is the most common etiology of back pain. Okay. This one is what we attribute to issues with posture.
Right.
Everything else has to do with the, say, spondylosis, for example. It has to do with long-term wear and tear of the bones and muscles of the back. Uh, Intervertebral disc herniation, again, it has to do chronic, issues with posture can definitely lead to issues with the disc, but definitely, you know, it has to it originates in older patient groups because it takes a lot of years or some kind of trauma even to the back for this to originate. And then, anatomic abnormalities like such as scoliosis or spondylolisthesis. Scoliosis is like, there is a issue with curvature of the spine. Again, that can lead to back pain, spinal stenosis. So a lot of terminologies, as you can see here. And then the second category is, something happening in the body as an overall problem can manifest as back pain. So infection, and then there's this inflammatory back pain is another category where autoimmune issues of the body can lead to back pain. Here we see a lot of these, inflammatory back pain. We see the pain, seeping into other joints of the body as well. So it will be more generalized. And another characteristic of inflammatory back pain is that it can lead to early morning back pain and stiffness as soon as someone wakes up. And then there is this middle category where mostly old patients experience this. This is due to metastasis, meaning they'll have cancer somewhere in the body, and then it will either spread to the back or to the spinal bones, the back muscles or the spinal bones, causing them chronic back pain. Okay. And then there is this third category, which is called referred pain, meaning there's a problem happening in some other organ. um, it is not systemic, it is not all over the body, and it is not primarily in the back, but there is an organ that is primarily affected, and then there is shared nerve distribution. So some of the nerves connecting to, say, aorta or pancreas or the kidney, right, uh, also supply some of the nerves to the back as well. So hence, some pathology or some issue happening with these organs can manifest as a back pain without nothing being wrong with back. So you see, because there are so many issues which are like, so vast, we can understand why it is such a common problem. And fortunately, I would say, and even literature says this, 90% of the back pain is because of musculoligamentous injury. uh, Basically issues with the muscles and ligaments of the back. And just to give an idea of the back, right, the muscles, I just use this 3D diagram, so we can see that this is the back area, and then this in the middle is the spine. And we know, by biology classes, that humans are the only ones that can balance their body on their 2 feet, right? All other organisms are uh, unable to posture them in this erect position. And the reason why us humans can, balance our central body, right? We call this an axial skeleton as well, because this is the axis of the body. We can balance it because of there are so many muscles here which anchor the spine, almost like, the ropes of a ship anchor its sails, right? So they pull them, they pull the spinal bones on various sides. So this is the first layer. And if we say hide this, right, see there are again multiple muscles underneath as well, small muscles, which are like literally pulling the spine and anchoring them to some location on the side, or the opposite as well, like they might be pulling on some horizontal location, like for example these muscles, infraspinatus for example. They pull the side of the body and anchor it somewhere in the middle, so it gives a the spine is a massive point of anchorage for a lot of muscles. And there are like, you can see this is the deeper layer, and if we hide that, right, there's again another layer. And then as we keep hiding them, right, finally we reach the spine underneath that. So we can see that there's so many muscles anchoring the back. So this is why posture becomes extremely important, because when we are holding on to ourselves in a good posture, right, all the muscles, like, all the tension is distributed evenly among all the muscles of the back. And the problem when our posture is not good is that the strain of anchoring the axial skeleton gets unevenly distributed in, say, some uh, specific area of the back, causing that muscle to get fatigued, or the excessive pull that, that certain region is causing on the spine to, say, affect the bones. Basically, you understand, right? So this uneven distribution of strain is what happens in when the posture is bad. And I think we cannot see it in this model, but there are three curvatures of the spine. One is this cervical area, which curves forward, and then this thoracic area, which curves backwards, and then there is a lumbar region, which curves again. These three curvatures are again very important in order to distribute the strain that all these small muscles have to undergo in order to position our body in a proper axis, and these curvatures are again when our posture is not good. These three normal curvatures of the back are not maintained, which causes, uneven distribution of strain over the muscles again. So if it is, over a period of a few days, or, if it is because of somebody just sleeping in a wrong posture without the knowledge, or they were stuck in a crowded bus or in a metro where, they couldn't maintain a proper posture, most of the time they wouldn't even experience some issue as such. But when this goes on every day, right, for a very long period of time, uh, the muscles and the spinal bones, they start to accumulate damage over a long time. Uh, and this is why, back pain can become chronic, taking medications for it, or doing exercises on it for a short period of time might not relieve the damage that has been accumulated over these muscles over such a long period of time. So since the damage occurs over a long period of time, the treatment or the relief from it can be obtained through a long period of time as well. And correcting the posture would be the foundational treatment in treating back pain. So, and again, just wanted to, I'm still audible, right? I'm sorry.
Yeah.
Ah,
Please, I just we've muted us ourselves so that
no,
there's no
yeah,
disturbance.
just wanted to check in between. And then now coming back to the desk jobs, right? So when we are sitting down on a chair, uh, the center of gravity of a body is not the same as the center of gravity when we are standing, right? So when we are sitting down, most of the weight is anchored on the, lower, the pelvic regions of a body, and we can, like, uh, when we sit down, and the legs are not contributing much to handling the center of gravity as compared to, say, when we stand upright. A lot of the distribution of weight uh, is also shared by the muscles of the legs, which are the sturdy muscles of the lower back and the legs, right? They contribute to this distribution of strain. And also, while standing up, there is a wider range of motion that we can you know access, meaning a lot of joints are more mobile. And so many doctors or many physical therapists, right, they consider sitting down as a little bit of a disadvantaged position to be at, because first of all, the center of gravity is kind of in a weird situation there, putting a little bit of extra strain on the muscles of the back, because we do not have help from the muscles of the legs. And the second issue is that the curvatures of the spine, the three curvatures, normal curvatures of the spine, right? Many of the times they cannot be in the normal uh, way when we are sitting down as compared to when we are standing up. So considering these two issues, right, along with maintaining a good posture while sitting down, it is also important to take periodic breaks from sitting down itself. Even though it is a good, even though someone is maintaining a good posture, if they are sitting down constantly for 7 to 8 hours a day, without standing up, without any mobility to the joints, right? It can definitely cause uneven distribution of strain over the muscles of the back, and this uneven strain can, over a long period of time, over say months or even 4 to 5 weeks of this happening continuously, can definitely turn into a back issue. So I think that's all is the need of my screen. So I'll just stop presenting it now, so we can get into more specifics based on your questions as we go on now.
Yeah. I think to continue the previous question, back pain you mentioned is the most common posture related issue. Uh,
Mhm.
is there anything else that, is there a particular term that we are not as well versed with? Any other issue that you see, and also the age distribution and gender distribution, you can shed a little bit more light to that.
Yeah. Uh, so regarding the age distribution, right? Most of the back issues that arise in children is because of some sort of, trauma, falling down. It is very common among that age group. Uh, like, and but the body of children is very robust in terms of healing, and they're usually extremely mobile. So they do not sit down, they do not you know, uh, get into anything that would cause chronic issues. But recently, right, there is definitely uh, you know more number of patients who are younger that are coming to us with chronic back pain as well, surprisingly, which is mainly because of the digitalization again. A lot of their online classes, and then they tend to sit down a lot of the time, watching some entertainment on their tab or their phone. Uh, there's not that usual picture of children who are uh, very active and mobile. So the posture related issues are creeping up to the younger population these days. But other than that, most of the issues that are related to back pain in children are because of uh, trauma, falling down, getting into a fight with a kid. And very rarely, there might be some not genetic, but hereditary issues in children, which can cause chronic back pain. So, scoliosis, for example, if children are born with scoliosis, where the curvature of the spine is not um, normal, right? Uh, and certain other issues such as spina bifida, and these are hereditary issues where the musculature of the back is not properly developed, thereby exposing a lot of nerves to the outside. So these are all issues that we encounter in children, and in young adults, and up to the age of 40s, right? Predominantly it's because of two reasons. One is because of the posture, because of their work lifestyle, and another is because of trauma. And the trauma in this age group is not due to falling down or not due to getting into fights, but because of not doing the exercises in their intended way, especially in a gym, or weight bearing exercises, using weights in a gym, right? When they are not done properly, absolutely very detrimental to the back and to many other joints. Uh, and then the other field where they can, apart from the gym, right? Even if they are doing yoga, and they are not doing them under proper supervision of yoga teacher, right? Many of the asanas that they do, um, if they are done wrong, and they are done wrong over a long period of time, because obviously, right, if they are not monitored by a professional or a teacher, is like a trauma to the back, and it can lead to chronic back pain. So the two common issues are, just to summarize, in this age group, uh, sitting at a desk job, posture issues, and then trauma to the back because of doing exercises and yoga in not the most optimal way that they're supposed to be done. And just getting into a third subcategory in the same age, right, is autoimmune issues. Say it might be lupus, ankylosing spondylosis, right? Autoimmune issues are something in which the immune system of our body, right, attacks itself because of being very hyperactive. Right, some infection might have happened over the past, some environmental trigger, right, which causes the immune system to become extremely hyperactive, and it loses this ability to distinguish between itself meaning the body, and the pathogen that is causing the issue, and it can start attacking the joints of the body. So, for example, there's a condition called lupus. The full form of it is systemic lupus erythematosus, SLE, which Selena Gomez had famously, has still, where one of the primary symptoms that they come to a general practitioner with is very debilitating, extremely sharp pain in multitude of the joints, uh, which is very intolerable for them, right? And it is very easy to confuse autoimmune diseases with something that happens very commonly, such as posture-related pain. So they might even go undiagnosed for a very long time. And then there is in terms of gender differences, right? Autoimmune diseases are very, very widespread in females compared to men. Men do experience it, but for the majority of, 9 out of 10 patients who experience autoimmune diseases are girls and women. Right? And then there is a new category now, which is fibromyalgia. Uh, Fibromyalgia, it is not an autoimmune disease, right? It doesn't happen because of issues with the posture. But what fibromyalgia is, and until now, we do not know the exact cause why it starts. The theory that is most accepted these days, until research gives us more information about it, is that some kind of trauma, both physical and psychological, or an infection which was overwhelming, triggers a region in the brain which increases sensitivity to the pain, right? So it is almost like the body is anxious, meaning when we are anxious, we are very hyper vigilant about seemingly not so serious things, things that others might handle very normally. Anxious people, they tend to get very hyper vigilant, or they start overthinking about these things. Fibromyalgia is the anxiety of the body, not of the mind, in the sense that even the slightest of the pain that might arise somewhere, it becomes extremely painful for them, and it might lead to them even going to the emergency room, um, multiple hospital visits. And since fibromyalgia is uh, there's no proper blood tests or scans that can delineate exactly that this is fibromyalgia. It is purely based on a clinical picture. So it is a difficult diagnosis, but it has become common, and again, fibromyalgia is more common in females, just like autoimmune issues, and it can be a very debilitating cause of back pain, but not just back pain. It can cause issues with joints of other areas of the body as well, definitely, because uh, one of the things in the clinical picture that we look for in fibromyalgia is that multiple different areas of the body are experiencing very high levels of pain, along with fatigue is another common component of fibromyalgia, and cognitive issues such as the mood being very low. So as such, I wanted to mention fibromyalgia because while we consider 90% of the back issues arise due to issues of posture, we should also be very mindful about these other conditions which can really mask themselves to be issues of posture, and issues of posture definitely contribute to them. A normal a person without fibromyalgia might experience issues with bad posture differently compared to a person with fibromyalgia experiencing problems due to issues of posture, in the sense that the pain experienced by patients with fibromyalgia is very severe, right? And then we go to the final category, which is the age of above 40. Here, hormonal changes take the limelight, right? Estrogen is a very important hormone for the bones in the body. So as women approach their late 40s, right, levels of estrogen, they start going down. And as they approach menopause, the levels of estrogen, they start slightly going down, and after menopause, they continue to go down. This affects mainly women in a very negative manner. They can experience a variety of issues related to musculoskeletal pain and osteoporosis as well, and they have a very likely risk of getting fractured. Uh, it is easy for women who are approaching menopause or who have already had menopause to undergo fractures because of this low estrogen levels happening. And men of this age, right, although it is not as common as women, but they do experience low levels of estrogen as well. Because in men, estrogen serves the function of maintaining healthy bones as well. And the source of estrogen in men is mainly because of conversion of a part of their testosterone into estrogen. So when testosterone starts to get down, right? Uh, because again, they are reaching the late adulthood. Uh, Testosterone can definitely start to come down, and this affects the level of estrogen in them as well, causing an increased risk of osteoporosis and fractures, definitely. And just the late, you know, the final very old geriatric group of patients, right? The main cause of back pain in them is, again, just like children, falls, because they lose the sense of balance, and a lot of their muscle mass is reduced. So they cannot anchor the body in various planes that youngsters can anchor themselves. So a lot of older patients experience back pain and even fractures due to falls, which can really worsen their quality of life and might even reduce their you know unfortunately their lifespan when one of these debilitating injury happens. Cancers, again, cancers that are colon cancer, pancreatic cancer, cancer of the prostate, cervical cancer, all these, right, they are very much in the lower back region, and they really do cause debilitating back pain, uh, and even destruction of the bones of the spine if they do end up spreading to the back. And this happens again mainly in the geriatric population, say the very older population above 60. So just to summarize, in younger and adolescent patients, the main cause of back pain is either because of trauma, falling down or getting into a fight, or because of some congenital hereditary issue that has caused issues with the curvature of the spine. In the early adulthood, the causes of back pain, the common causes are because of posture, because of their job, um, or due to trauma pertaining to their exercise, which is not done properly. And in the middle, like, older adults, hormonal changes take the limelight, which is more common in women um, because of dropping levels of estrogen. And as we get to the geriatric population, again, just like children, falls are very common with them, and they have a very low muscle mass. So you get the brief picture of the common causes of back pain now. So if there are any specific questions you would like to build up on that, we can do that.
Um, I think that gives us a great idea about the various factors that go into this. I think we want to kind of understand what is an ideal posture according to you. I understand there's, as you mentioned, there are two ways to assess it. One is sitting down and one is standing. So considering a desk job, what would be the ideal posture where your muscles are not in strain?
Yeah. So one major thing to consider is um, the rounding of the back that happens when we sit down, right, where the muscles droop forward. We feel that somehow that is more relaxing. Many times we do not even observe that, but we just slouch a little bit while we are working on something very intensely over a long period of time, because sitting up straight, it does take some effort, and it can get very tiring as well. But while it gets tiring, sitting up straight does prevent that slouching of the back. Sure, the muscles do get fatigued more when you're sitting up straight, but there is no uneven distribution of strain over in a certain group of muscles that can accumulate damage over a period of time. Okay, so the ideal posture would be to avoid rounding of the back while sitting down, while not putting excessive force to completely straighten the back. Right, as we have discussed, there are three normal curvatures of our back. One, there's a forward curvature in the cervical region, and then there is a thoracic curvature, and then there is a lumbar curvature, right? These curvatures, you should be mindful of these curvatures, and as much as possible maintain these curvatures while sitting down, right? And then sitting without back support, right, as in like a supporting surface over the back. It might be the chair, it might be the wall, and in some cases ergonomic chairs which support the curvature even better. Sitting with a surface supporting the back is always better, because while sitting without a back support, right, it is very easy to get fatigued in a good posture, right? While we're sitting without a back support in a good posture, it does tire all the muscles equally, and there's a greater predilection for us to slouch and round the back when there is no proper back support, surface supporting us. So that's it really, like, you should be mindful of the curvatures of the back without causing rounding of the upper back excessively. Do not slouch the shoulders, and sit with proper surface supporting the back, and if possible an ergonomic surface which adjusts itself to the natural curvature of the spine. And when this happens, again coming back to the the theme that we are following, right, there will be equal distribution of strain in order to anchor the body in the position, thereby not unevenly distributing strain to any particular muscle group in the back, and thereby preventing damage from accumulating, right? And it is also an important aspect to not just sit down throughout the whole span of the work, but to take periodical breaks to stand up, stand up, walk around as much as possible. If possible, stretch around the back muscles, if it is appropriate in the space that you are working. So some people even keep reminders in their phone. There are apps as well that will remind them to take a break from sitting down constantly, stand up and stretch the back. Say an appropriate time to set the breaks would be every 1 hour. Every 1 hour, it is very good to stand up and stretch the back. And then the third thing is the positioning of the laptop itself or the PC, right? Many times we position our laptop in a way that the neck has to bend down, seeing it. Even the phone, while you're holding the phone in our hand, right, we have to bend the neck. That negatively impacts the cervical normal curvature. So a good way to prevent bending down the neck while working is to set up the monitor just perpendicular to your visual line, so that you can, sit down in a manner that you don't have to bend your neck. So there are a lot of stands available these days on the market, which are even, adjustable according to the height, depending on the surface where you're sitting down, so that your laptop will be at the visual line, instead of you having to bend or, yeah, that's it. So just to summarize this, right, so that it is concrete, we should sit down while being mindful of the normal curvatures of our back, not too straight, not rounded over the upper back. And we should take, there should be a proper surface supporting our back always. Sitting without back support is almost always detrimental, and I would say it almost always leads to chronic back pain. Sitting on the bed, for example, or sitting on the floor while working, very bad for the back. And then standing up to take breaks once in every hour, if possible, stretching the muscles of the back, and then adjusting the monitor of the laptop to the visual line, so that you will not have to bend down your neck for a long period of time while working. These are the things to be followed.
Okay, thank you. I mean, this is again from experience. I wanted to also inquire about other kind of factors that contribute or sort of aggravate these posture issues. For example, low vitamin. That's been a very, very common trope in the whole country, I think, because we are not
Mhm.
out after COVID, etc. And so just wanted you to shed light on that part also a little bit.
So, not exactly contributing to the posture issues as such, but to back pain definitely, and the health of the joints and muscles of various regions of our body. Vitamin D is very important, because vitamin D is like the cousin of calcium. Without vitamin D, calcium doesn't get incorporated into the bones, and without vitamin D, calcium doesn't get absorbed in the intestine. So over the long, and calcium is the major, the minerals of calcium are the major components of bones. Uh, so what happens when there is low vitamin D, right? There will be low calcium minerals in the bones, and over a long period of time, this can lead to brittle bones. The common, terminal, the colloquial term for osteoporosis. Bones become brittle, right? And when bones become brittle, you know that the various muscles which are anchored on the bone, right? That is definitely a strain to the brittle bone, and bad posture in people with low vitamin D and low calcium in the diet, right, can lead to easy fractures, uh, even with seemingly non-serious traumas, right? Just falling in the bathroom or slipping down from the stairs, they can definitely contribute to fractures in these patients. Uh, but keeping fractures aside, right? When bones become weaker, they definitely start causing pain because of bad posture more often, uh, and the muscles constantly pulling on them, pulling on a brittle bone. Uh, it doesn't, the bones, they become very incapable of handling such a strain on them, and they can start developing abnormal ways to handle this by, say, trying to deposit excessive calcium in some regions of the bone, and this leads to irregular remodeling of the bone. Okay, so one example of this, without going too much into the technical details, right? The spine, the spinal bones, the vertebral bones in the center, right? when they become osteoporotic, they can turn into, they can start adopting this abnormal remodeling, thereby compressing the nerves that are exiting through them, because there are this foramen or the holes through which nerves exit the bones in the back. And when they become, you know, the holes become smaller because of, calcium being abnormally deposited in that region, it will start, compressing the nerve that is exiting it. And this can lead to problems such as sciatica, because sciatica is a disorder where nerve is being impinged, either because of the hole through which it is exiting is becoming narrower, or because of a slipped disc putting pressure directly on it, right? And slipped disc, again, like, it is another issue which can happen because of osteoporosis, where uh, the discs between the vertebral bones, right, they are like the cushions. They really take up a lot of mechanical forces that are harmful to the bones upon themselves, because they are like a jelly type of material that is present between the bones. But when osteoporosis happens, or when bad posture is going on for a very long period of time, when there is abnormal remodeling of the bone, or when there is defect in the curvature of the spine due to scoliosis or other some other rarer issues, right? This jelly-like substance which is present in between the vertebral bones, it can slip out, you know, and when it slips out, right, it can uh, impinge, meaning it can start putting pressure on one of the nerves which is surrounding it, and this causes shooting pain in the back. Uh, and typically, the pain due to sciatica radiates to the legs, because these nerves travel from the back all the way to the ankles. When one of these nerves is impinged, the pain can definitely shoot from the back to the the lower back, and the legs. So yeah, did I?
Right. Yeah, I think we've covered most of the sort of heavy questions. The next few we wanted to get like quick suggestions from you. First of all, what are the, well, you've already answered this. People believe that it's hard to fix bad posture. Do you agree? Like, how hard is it to fix bad posture?
Uh, Again, I think it is subjective for the majority of the portion. If they start becoming conscious about their posture, right, and they start to observe what is a correct posture and what is a wrong posture, if they have that differentiation in their mind, and they start to become more mindful about their posture, right, I think over some period of time it becomes a habit. It becomes an unconscious process for them. But in some people, right, who have, like, say, osteoporosis, for example, or fibromyalgia, or scoliosis, where the curvature of the spine itself is a little bad, and women who are approaching menopause, or men who are approaching their 50s with lowering levels of testosterone, in these people, right, uh, maintaining a proper posture might be very difficult in this small subset of patients,
Right.
because while they do try their best to become mindful about maintaining a proper posture, their body might not be very cooperative in achieving the same. So, in summary, in majority of the patients, as long as they start differentiating what is a good posture and what is a bad posture, and they are conscious that it is important for me to maintain a good posture, I think it becomes an unconscious process. And in the small subset of patients, even when they really try their best to maintain a good posture, their body might not cooperate. That is where, back braces, um, ergonomic chairs, and even there are some, in fact, like recently, while preparing for this talk, right, I went through what are the technological options that help with posture. I did see that there are some fabrics that are designed with sensors, so a shirt, it has sensors in it, where if they stop maintaining a good posture, right, it gives them an alert, like, the curvature is not right. So you'll have to uh, make a correction. There are even virtual reality apps that are being incorporated in some work offices these days, in order to, like, uh, give a notification to their employees whenever one of them is not maintaining a good posture. uh, AI, many people are using AI in order to create apps and even mechanical devices that will help with proper postures. So, all this, like, braces, technological support that we can obtain will be very useful for people who have issues where their body is not cooperating with maintaining a good posture.
And that sounds really interesting. If you have some links, it'll be great for us to delve into it.
Yes, yes.
That fabric that you mentioned.
Mm-hmm.
Okay. Okay, is there a case that you might be able to cite? I think you've sort of covered all of these. Guys, anything else that you would want to add? I think Dr. Nitin has covered quite a lot already.
Yeah, I hope I was, clear, and I was not, shifting from topics to topics or rambling at any point. I hope I was clear. If there are any questions, in terms of back pain or posture related issues, uh, please feel free to, bring them up.
Yeah, I had a question actually. I was wondering like how much like body type affects posture, like your height or your weight. Because I'm tall and I've heard people say that because I'm taller, I have a tendency to slouch more. Like while growing up, I was very always asked to like sit straight or like maintain posture because like apparently at least I was told that it's very easy to slouch if you're on like the tall if your height is taller than versus your short. So just want to understand that.
Yeah. So a lot of the times, right, the body type. So, for example, taller people, right, they are more prone to certain. First of all, before going into health disorders, taller people who do not even have any sort of organic health issue, right? They definitely do tend to slouch, in order to not stand out, like say while sitting in a group in the classroom, or to not stand out while walking around, or while standing in a bus, for example, if they are reaching the roof of the bus, right? They tend to kind of modulate their posture. So a lot of small adaptations like this ultimately leads them to developing a habit of kind of rounding their upper back. Okay. Even while sitting down, they tend to it would have become a practice to round their back. So I would say it is more common among taller people to develop this. Secondly, taller people, some of them, right, they can be born with certain issues with collagen in their body. There's one example, Marfan syndrome, Ehlers-Danlos. So these are some conditions where the muscles and the bones are not very healthy, right? So they will not have certain components that healthy people would have in their own bones. Again, this is just to add context as to the height differences, right? So if taller people, they have chronic issues with the back, and something doesn't seem to be right when compared to their peers, right? We can definitely investigate them as to if there is any organic issue present that is contributing to this. And third thing is uh, our body type, right? It definitely contributes a lot to our self-image. So if there are issues with the self-image, right, people tend to, you know, be uncomfortable. Like, you know, they tend to take up less space, say, while in a group. They tend to compromise their comfort just in order to accommodate the general social gathering. And people with the better self-image might not do that. Right? You know, they might take up the space that they need in a social gathering, or sit in a confident manner in a meeting, etc. While people with body issues might, you know, easily compromise on these things in order to fit in better. And again, the fourth category is when um obesity, right? Obesity might not might obesity definitely, you know, can contribute to various musculoskeletal issues, but definitely back is a major one. Again, because the muscles have to work very hard in order to maintain the axis in a normal posture. So over a very long period of time, they might get you know, chronic back issues. They might get issues of the joints, because the joints have to bear extra strain, right? So yeah, I think those are the four aspects we have to look into.
Thank you. I think
Yeah, I mean, just a couple of tips on how do you maintain your posture as well, and we can conclude through the day. Do you use something additionally to keep better posture?
Yeah. So again, I've definitely experienced a lot of back pain during multiple occasions of life as well, right? Uh, Sometimes while working, yeah, work shifts for doctors is generally very bad, and sometimes there have been 36-hour work shifts where, you know, doctors, they tend to sleep on benches or on stretchers wherever they can find space in a hospital. So I've definitely experienced back pain and chronic back pain as well. So which has you know, kind of pushed me uh, into or forced me into being more mindful about my posture while sitting down or while sleeping somewhere, uh, and then be more you know, physically active, and not just stick to sitting down continuously for many hours while working. And then I've had instances where I've had injuries in the gym because of, you know, doing some heavy duty exercises like a deadlift in a not very ideal way. So I've had to, you know, take proper guidance from a physical therapist or a physical trainer. So again, but in summary, being mindful about my own posture while sitting down, and taking breaks to stand up uh, during a long work day. These are the two things that I really try to follow.
Okay, thank you.
I think last question I had was, what would be that one standout myth that you can think of when it comes to, say, like a good posture?
Yeah, a standout myth would be, you know, many of the physical training professionals in schools and colleges, right, they really ask the students to stick, like, stand up or sit down absolutely straight, as if like as a rod, like extremely straight to I think that is not healthy, especially when done regularly. They should be mindful about the normal curvatures of the back, and they should be putting the least possible effort to maintain that, in order to like least possible effort to maintain these curvatures, and not put excessive effort into maintaining an excessively straight back. So that is a major myth that I think. Anything that like you guys have heard of as myths, or like commonly that you encounter?
I don't know if it's a myth or not, but this standing desk has become a trend. And
Yeah, again, yes, that is a good point. I wanted to mention that earlier, but I forgot about it. It is not a myth. Like, standing has a lot of advantages while working over a long period of time as compared to sitting. But again, standing throughout the work period definitely is not ideal as well. So finding the right balance between sitting and standing uh, is the way to go. So desks which are a little versatile, they'll be useful while sitting, as well as adjustable to a standing posture. That would be ideal. But a majority of the work spent standing as compared to sitting seems more ideal. Even like a lot of YouTubers these days, right, when making their videos, are shifting towards this kind of a standing desk setup rather than sitting down. I think it's very beneficial. So it's not a myth. It's definitely beneficial.
yeah.
Right. Okay.
Thanks a lot. We've learned a lot from this session. We at this point are gathering all the info that we can, and at this point we are not sure how we're going to present it, but we are hoping to make something engaging out of all the notes that we gather, and we'll definitely reach out to you for anything further that we might have.
Yeah, sure, absolutely. And all the best with the project. And if possible for me to contribute more, do let me know. Yeah.
For sure, for sure.
Yeah. Very nice meeting everyone today.
Okay. Thank you so much.
Thank you.
Yeah.
Thank you.
Thank you. Thank you. Bye bye.
Bye.
Bye. So I'll be leaving then.
Thank you.